Customer segmentation is the process of dividing a market into distinct subgroups, each of which share important internal similarities with clear differences from the other subgroups. This enables you to market effectively to the different subgroups, prioritizing those who present the greatest opportunity. The end goal is to identify a customer group or groups and usage situation for your brand, which is broad enough to contribute a substantial business result and compact enough to be addressed profitably. Combined with the customer portrait, this enables differentiated customer engagement. Segmentation occurs at the chosen leverage point in the buying process. As a brand team, your first step to segmenting your customers will be to brainstorm a list of variables which can discriminate customer groups at the selected leverage point. This might include physician variables like specialty or experience, and usage situation or patient variables such as age, severity of disease, or risk level. For example, you may propose that treatment choice is different according to different physician subspecialties and varies according to whether the patient is controlled or not on current treatment. Having brainstormed the available variables, you must then assess which of these are meaningful and actionable. A meaningful variable will show strong similarities within the group and strong differences between groups, both of which are related to the behavioural objective. For example, if physicians of one subspecialty more frequently favour one treatment choice, while another subspecialty choose a different treatment, an actionable variable is one that can be used to market effectively. In this case, can we use this variable to identify the physician and their patients? For example, physician subspecialty is usually readily available information, whereas physician age may not be. There can sometimes be a trade-off between finding a variable that is both meaningful and actionable. Once you have decided on the variables to prioritize, develop your segmentation frame. Segmentation frames usually have one axis with physician variables and one axis with usage situation or patient variables. The customer segments are the intersection between physician groups and specific patient types or usage situations. Let's take an example in which the chosen leverage point is treatment choice. Our behavioural objective is to prescribe IVIG maintenance therapy. We decide a meaningful and actionable physician variable is subspecialty, and two meaningful and actionable patient variables are the type of CIDP, typical or atypical, and the frequency of relapse. We now have segments based on the intersection of these variables. For example, general neurologists treating typical CIDP patients with a frequent history of relapse, or peripheral neuropathy experts treating atypical CIDP patients with a low frequency of relapse. These are your customer segments. Finally, evaluate the segments to help you prioritize the segments to focus on. What is the size of the opportunity in the segment? How much investment is needed to change the segment's behaviour with our capabilities? How is our brand currently perceived in this segment compared to the competition? To what degree does the segment influence other segments? By asking these questions, you can identify your priority segments and quantify the opportunity that they represent relative to your behavioural objective. In our earlier example, we have now added in the number of patients that exist in each segment to help us prioritise. Straight away, we can see that other neurologists only see a small proportion of patients in comparison to general neurologists or peripheral neuropathy experts. These segments can be assigned a low priority, since they represent only a small opportunity. We also need to think about what is achievable in relation to our behavioural objective. Patients with low frequency of relapse are less likely to be prescribed an IVIG maintenance therapy, and thus these segments should be assigned a medium priority. On the other hand, patients with a high frequency of relapse are much more likely to be prescribed a maintenance therapy. We can also see significant patient numbers being treated by general neurologists and peripheral neuropathy experts, so we should assign these segments a high priority. These are the prioritized customer segments we should focus on. Next, you will need to develop detailed customer portraits to help you further refine your segmentation and define key drivers and barriers for your prioritized customer segments. Learn more about customer portraits in our next video.